Prostate enlargement, more formally known as benign prostatic hyperplasia, BPH, is a common condition in men. While BPH is not cancer, it does bring with it a host of annoying urinary symptoms such as needing to pee all the time, a sudden urge that you just can't ignore, a weak stream, or even feeling like your bladder never fully empties. BPH gets more common with age. About half to two-thirds of men in their 60s deal with it, and by the time you hit your 70s, it jumps up to nearly 80 or even 90%. You might also find yourself waking up a bunch at night to pee. That's called nocturia, which can wreck your sleep. Or running to the bathroom so often during the day, which can totally throw off your routine. Treatment can look very different depending on how severe your symptoms are. For milder cases, it's just wait and see paired with a few lifestyle tweaks. If it's more serious, doctors may suggest medications, minimally invasive procedures, or even surgery. It really depends on how big your prostate is, how much it's bothering you, and your overall health. But there's one thing you can take charge of right now: your diet. While food alone won't cure BPH, certain things you eat or drink can make those symptoms worse. Think irritation in your bladder, extra inflammation, or throwing off your body's fluid balance. So, if you or your loved one is suffering from these symptoms, you've come to the right place. In this video, we're discussing the foods and substances you might want to avoid if you have prostate enlargement. Everything we cover comes straight from the latest research. Stick around to the end. You'll walk away with simple, science-backed tips to help keep your symptoms in check. Let's get started. Number 1. Capsaicin. For many people, after a long day or during a weekend party, nothing beats relaxing with a cold beer and some spicy food. That is a go-to combination. However, capsaicin, the active compound that gives chili peppers and spicy foods their heat, has been identified as a potential irritant that may exacerbate BPH symptoms. It is listed as one of the worst things for patients with BPH. Capsaicin's potential to harm BPH patients is tied to its physiological effects on the urinary system and inflammation. It can activate sensory nerve endings, particularly in the bladder and urethra, leading to irritation. In BPH, the enlarged prostate already narrows the urethra, so additional irritation can amplify symptoms such as urgency, frequency, and a burning sensation during urination. Capsaicin can also trigger localized inflammation in some individuals, exacerbating the existing inflammatory environment in an enlarged prostate. Furthermore, capsaicin activates transient receptor potential vanilloid 1, TRPV1, receptors in the bladder, increasing sensitivity and potentially leading to overactive bladder symptoms, which are common in BPH. This can intensify the sensation of needing to urinate frequently or urgently. So if you've noticed that your symptoms, such as frequent urination or an uncomfortable sense of urgency, worsen after eating spicy food, it might be time to dial it back. Here's how. Try to avoid or limit foods that are high in capsaicin, such as chili peppers, hot sauces, spicy curries, and seasoned dishes. Instead, use milder flavors such as herbs like basil or turmeric. The anti-inflammatory properties in these may also help relieve your symptoms. Additionally, keep a food diary to identify personal triggers and consult a healthcare provider or dietitian for tailored advice, particularly if your symptoms persist. Number 2. Aspartame and sucralose. As an artificial sweetener, aspartame can disrupt gut microbiota, leading to systemic inflammation and weight gain. Inflammation is a known contributor to BPH progression, as it can worsen prostate enlargement and symptom severity. Obesity can also increase pelvic pressure, exacerbating urinary symptoms such as frequency and urgency due to added pressure on the bladder. Like other artificial sweeteners, aspartame may act as a bladder irritant in some individuals, potentially increasing sensitivity and leading to overactive bladder, OAB. BPH patients often experience OAB-like symptoms due to urethral obstruction, and aspartame's irritant effects could exacerbate these symptoms, making urgency and frequency more pronounced. Additionally, some research suggests that aspartame could affect insulin levels and metabolism, potentially influencing hormone levels linked to prostate health. These hormonal imbalances could then indirectly contribute to prostate enlargement or symptom severity. Sucralose is another zero-calorie artificial sweetener commonly used in diet foods and beverages and marketed under brands like Splenda. It is derived from sugar through a chemical process, is approximately 600 times sweeter than sugar with minimal impact on blood sugar levels. While generally considered safe by organizations like the FDA, some studies suggest potential health risks, including inflammation and metabolic changes, which could indirectly affect prostate health. Therefore, patients with BPH should limit intake of diet sodas, sugar-free gum, and other products containing aspartame or sucralose. Instead, opt for natural sweeteners such as stevia or honey in moderation, and consult a healthcare provider for personalized advice to manage BPH effectively. Number 3. Margarine. Margarine is considered an ultra-processed food because extra ingredients, such as emulsifiers and artificial colors. Margarine, especially traditional formulations, often contains trans fats created by hydrogenating vegetable oils to make them solid. While margarine is often marketed as a healthier alternative to butter, some margarines contain significant amounts of saturated fat, especially if they are not labeled as low-fat or non-hydrogenated. Both trans fats and saturated fats are linked to systemic inflammation, which is a key factor in BPH progression. Chronic inflammation can worsen prostate enlargement, leading to increased urinary symptoms. Additionally, margarine is considered an ultra-processed food as it can have additives added during production, such as emulsifiers and artificial colors. It also often includes preservatives and flavorings to improve texture and shelf life. While generally safe, these additives can act as irritants, particularly for sensitive BPH patients. Therefore, if you already have BPH and are prone to urinary irritation due to an enlarged prostate pressing on the urethra, the additives in margarine, combined with its trans fat and saturated fat content, could potentially worsen bladder and urinary tract sensitivity, leading to increased urgency or discomfort. Healthier alternatives include olive oil, avocado oil, and non-hydrogenated spreads. Number 4. Wine. Like other alcoholic beverages, wine is a diuretic. It increases urine production by inhibiting the production of the antidiuretic hormone vasopressin, which normally helps the kidneys to reabsorb water. For individuals with BPH, this can lead to more frequent and urgent urination, which can be particularly bothersome, especially at night. Alcohol may also irritate the bladder, making it harder to manage symptoms like difficulty starting or stopping urination. Whether red or white, wine contains alcohol, and its impact on BPH is primarily due to this component. Research suggests that while moderate alcohol intake might prevent the onset of BPH, it does not alleviate established symptoms. Furthermore, alcohol can cause inflammation, which may constrict the bladder neck and make urination more difficult. This inflammation can exacerbate the obstruction caused by the enlarged prostate, leading to symptoms such as urinary retention or a weak stream. Another concern is dehydration, which can result from alcohol consumption. Although alcohol increases urine output, it can dehydrate the body if not balanced with adequate water intake. Dehydration can further irritate the bladder and urinary tract, exacerbating the discomfort for those with BPH. While moderate wine consumption might not increase the risk of BPH, for those already diagnosed, the diuretic and irritant effects of alcohol generally outweigh any potential benefits, particularly with regard to managing daily symptoms. Therefore, reducing alcohol intake, especially before bedtime, can decrease nocturia and improve sleep quality. Talking to your healthcare provider about your alcohol consumption can help tailor recommendations to your individual needs, taking into account both BPH management and your overall health. Number 5. Caffeine. Caffeine, which is found in coffee, tea, energy drinks, and some sodas, acts as a diuretic by stimulating the kidneys and increasing urine output. This can lead to more frequent trips to the bathroom, which can be particularly disruptive for men with BPH, especially at night. Caffeine can also irritate the bladder. It increases bladder activity and irritation, leading to the urge to urinate and potentially causing discomfort. Additionally, caffeine may relax the smooth muscles of the prostate and bladder, which could worsen urinary flow issues in men with BPH. There are several practical ways to avoid the effects of caffeine. The first is to limit caffeine sources. Reduce your consumption of coffee, tea, energy drinks, and caffeinated sodas. Opt for decaffeinated alternatives or herbal teas. Also, timing matters. Try to avoid caffeine in the late afternoon or evening to reduce nighttime urination. As individual responses to caffeine can vary, discussing dietary changes with your healthcare provider can help to tailor recommendations. Number 6. Sodium. Sodium, which is commonly found in salt and processed foods with a high sodium content, is known to affect fluid balance and blood pressure. High sodium intake not only increases urine production, it also causes the body to retain water, thereby increasing blood volume and putting additional pressure on the bladder. In patients with BPH who also have hypertension, consuming high-sodium foods can worsen BPH symptoms by hyperactivating the autonomic nervous system, which affects the innervation of the prostate and bladder in particular. Reducing the intake of high-sodium foods can significantly improve quality of life for those with BPH. Limiting sodium intake, particularly from processed foods such as sausages, ham, and pickled vegetables, can reduce the need to urinate at night, leading to better sleep. During the day, it can reduce the need for frequent bathroom breaks, enhancing comfort and convenience. Try opting for fresh and whole foods using herbs and spices instead of salt for flavoring and reading labels when shopping for groceries, as many packaged foods such as bread and snacks can be high in sodium. These are the main foods and substances that you should try to avoid if you have an enlarged prostate. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.